Good evening, everyone. I'm Dr. Ajit. I'm going to discuss you about the anti-epileptic drug. So, a anti-epileptic medication do not cure epilepsy, but rather attempt to prevent seizure. So, in case of seizure, there is a rapid firing of neuron. There is a irregular nerve transmission, and no doubt their function is uncontrolled. So, strictly speaking, these medications are anti-seizure or anticonvulsant rather than anti-epileptic. So, in this section, we will see the different classification of that anti-epileptic drug in terms of their chemical nature, their type of action, and some example are there. For example, barbiturate, the phenobarbital, in case of chlorine channel, it is just opening the chlorine channel to facilitate the chlorine to hyperpolarize the neurons. So like that, their mechanism you can also classify, but this classification is mainly for this classification mainly for the nature of chemical of drug. First, you have to think about the type of neuronal function takes place during the normal function of neuron. So there is a at the level of neuron there is a sodium channel, there is a chlorine channel, and there is some calcium channel is there in a normal function of neuron. For example, a neuron have to function with the opening of sodium channel to movement of sodium ion inside the neuron so that the impulse generation takes place. If it is a irregular impulse generation or uncontrolled nerve impulse, then seizure will be there. So like that, the mechanism may be considered for the drug action. Second mechanism may be like chlorine ion channel opening. If it is more open, then the chlorine ion will be more in the nerve membrane, and it is again get hyperpolarized. So like that, a calcium ion also movement of calcium ion also controls the nerve impulse transmission. So you can see there are three mechanism based by which the convulsion can be controlled. So for example, prolongation of sodium channel inactivation. So means what? If a sodium channel inactivation takes place, then the sodium can pass. So phenytoin, carbamazepine, valproate, these are the drug which is responsible for prolongation of inactivation of sodium channel so that the sodium ion cannot pass and the convulsion can be controlled. Second mechanism is just like chlorine channel opening. If it is open, then more chlorine will be there. So you have a idea of GABA receptor where the GABA can bind there and it can open the chlorine channel. Similarly, barbiturate and benzodiazepine also control the action of chlorine channel which is mediated through GABA. So these are the drugs which can be used for the opening of the chlorine channel, and it is called as facilitations of GABA mediated chlorine channel opening. So in case of there, barbiturate, benzodiazepine, vigabatrin, valproate, gabapentin, and tigabine are the drug which is responsible for the opening of chlorine channel so that the more chlorine will be inside, and it called hyperpolarization. We will discuss later how the GABA production or GABA metabolism also responsible for the control of this type of disease called for anti-epileptic drug, but it is a secondary. And the third one is the calcium channel mediated, that is the inhibition of T type of calcium current. For example, ethoxysuccinimide, valproate, and niacinamide. These are the drugs which can inhibit the T type calcium channel current. Transient T4 transient type, which is responsible for the transient current development at the level of neuron. If it is inhibited, then transient current cannot pass through the membrane, and nerve impulse or nerve activity can be slowed down. So ultimately, the effect of a drug, you can summarize that they have to be more relaxed neuron function so that the nerve impulse induction or some type of activity should be less. The secondary pathway is just like GABA synthesis. GABA synthesis, you know how it is GABA is the inhibitory mediator which is synthesized in neuronal terminal, and some GABA reuptake reuptake is also there at the neuronal junction. So once the GABA have to release, they have to bind in the chlorine channel, then function will be text. But if it is a reuptake, then the concentration of GABA will be less and the function will be limited. So that the some inhibitor of GABA reuptake, just like tiagabine, is responsible. Some GABA is also uptake by the glial cell, so you can also prevent by the tiagabine to reuptake by the glial cell of that GABA, and ultimately GABA concentration will be high. One also alternate pathway to just inhibit the metabolism of GABA inside the neuron, so that you can have some vigabatrin, valproate. These are the drugs which inhibit the GABA transferase enzyme, which convert the GABA to succinic semialdehyde. This metabolite is inactive, so you have to control the metabolism of that GABA, so that the GABA will be available more. So ultimately, the major mechanism of anticonvulsant action you can summarize with the help of this diagram. So there are major three type of mechanism. One is the prolongation of sodium channel inactivation, second one is the facilitation of GABA mediated chlorine channel opening, and inhibition of T type of calcium current. So these are the example of drug by which they can mediate. So you can see that the valproate is a drug which can act through all type of mechanism, and this all type of responsibility, maybe directly to the sodium channel or indirectly to the GABA transferase enzyme, or indirectly to the inhibition of inhibition of the uptake of GABA in the glial cell. So this calcium influx, this chlorine influx, then sodium influx, you can control the anti-epileptic activity as an anti-epileptic drug. So ultimately these are the drug which is prevent the seizure. So I think you are all aware of that type of anti-epileptic medication. Hope you will learn more in the chapter of the KDT I have shared to you note, and one note also. Thank you. Stay at home. Take care.